And again, we thank all of you for having participated in this workshop up to this particular time. Your insights have been very, very useful. So in this presentation, we actually take a look at where we are and future trends in the digital space. In this presentation, sorry, should I? So in this presentation, really, we are focusing on those initiatives, insights that are current and also both futuristic. And this is, of course, our way of preparing for the future and harnessing technologies that are yet to come. In this installment, we focus primarily on two major topics, which is artificial intelligence and blockchain, beginning with blockchain and proceeding to artificial intelligence. So we'll commence really by looking at the agenda, the topics. So we'll start off by discussing blockchain, specifically blockchain's application for health. And then we'll proceed to look at a number of aspects that have to do with artificial intelligence and its application. I'll lead the blockchain session, and my colleague Hani is going to lead on the artificial intelligence component. Now, before we go very far, I want to stress the fact that these kinds of presentations are both strategic and useful for both ministries of health, ministries of ICT, and WHO. There are common terms in the industry, and so it's critical for us to have an understanding of what is being talked about, and also what are some emerging implementations in this particular area. And those of you that have attended international conferences, for example, on the African continent, for example, Transform Africa in Kigali, blockchain was one of the topics that was both discussed in the main event and also at our side event on digital health. And at the same time, on the African continent, for example, in South Africa, there have been a number of seminars on blockchain itself. And a number of African countries like Uganda, for example, have developed associations on this particular subject. So what indeed is blockchain? We'll start off with looking at what's transpiring, globally, specifically in Estonia. Estonia is one of the first countries or the few countries that have really embarked upon implementation of what we're referring to as blockchain that I'll describe in a few slides in greater detail. So in about 2016, the Estonian government, the eHealth Foundation, embarked upon utilization of blockchain for the medical record systems that are deploying in that particular country. As many of you know, Estonia has digitized the economy. They have about 1.3 million, records that, are being carried by smart cards for the population. And what this project embarked upon to do in 2016 was to embrace blockchain as a means of security and also as a means of sharing the medical records themselves. Now, this particular package, of course, is well described on the eEstonia website. And so if you have time in the presentation, we can actually read the full article on how that was done. So when we say blockchain, what do we actually mean? So this subject was influenced by an article that was released in about 2008, an anonymous article that really articulated the idea of a purely peer-to-peer network as a basis for both ensuring security and transparency in transactions. And this really was looking at electronic currencies, cryptocurrency, otherwise referred to. So what was really advocated in this particular paper, which is indeed the utilization of peer-to-peer networks, that is to say, machines that have direct connections with each other, that notion of removing an intermediary in between, like a broker, the idea of having machines communicate with each other, was the basis of this particular article. And so blockchain as a concept rode upon this theory. And so when we really actually say blockchain, indeed, there are no physical blocks or chains, but it's an idea of information packages that are linked together in which form a chain. In this particular case, this diagram is quite useful and summarizes the high-level implementation of what the blockchain would actually look like. So one first component is that the items of information that are distributed across a network are referenced to each other. So the block of information that is in front points to its predecessor. What that basically would mean is that if you package information in a block or a location, that information is held securely. And once you make an edit or an addition, the subsequent record is reference has a reference to the previous record. And all the machines in the network have full view of that particular transaction. So the foundation of blockchain is really based upon being able to link information packages called blocks, and the chain, which is which really refers to the referencing of the subsequent blocks. So within the blockchain, or the block or area of information, you can actually store the actual data, which can be anything. It could be medical record data. It could be, information about your title deeds. It could be agriculture information. The actual content in the block can be anything. In this particular case, we're trying to see how we can actually utilize that capability to store medical records. Then secondly, around the block is reference to the subsequent block. And in some implementations, there is additional information or metadata called the smart contract, which is really a piece of information or metadata that informs how the block should be either accessed or how it should behave. So what we're really talking about here is a kind of a distributed database that has full view of all the machines that are participating in the particular network. Now, moving forward, what blockchain terminology includes is the notion of what I refer to as miners, who are really either machines that are viewing the blocks in the network or individual end users. And these particular miners or participants, who might be machines or physicians, have the responsibility of viewing and ensuring that the block network is not corrupt. That is the power of blockchain, being able to ensure that there is no corruption, data is stored securely, and also this arrangement makes the network of blocks there's an English word called immutable. That means to say you can't alter the record, because any change, all the machines or the miners or the participants must agree that this alteration is indeed a valid alteration. So the principles in this particular case of blockchain as follows. Number one, there is indeed must be a network of computers, and that's one reason this conversation is indeed taking place amongst ICT people, because they control the infrastructure, and the health people because they control the medical information. So there indeed must be the environment upon which this network or infrastructure should ride upon. Next is that the availability of a protocol, which is in this case the software or infrastructure that ensures that the blockchain itself is managed. For example, Ethereum is one of the protocols that are used to ride on the network to make sure that the blockchain transactions do indeed take place. And also lastly, the ability to make consensus or agreement. So when you make a change, is this change indeed a valid change? So the third layer is the ability of a mechanism for machines to agree to the particular modification that is taking place on a record. Now, some of the principles include transparency. That is to say that all alterations or modifications, additions, are taking place in a transparent manner. Authentication, that means to say that the information requires security protocols for you to be able to access it or view it, and also auditing, because you have a thread, which is a chain, so you can actually go back and see what the record was before. Now, there are a few examples of the implementation of blockchain in health. In this case, the advantages of blockchain in health. Key is data security. We speak of security so much, especially when it comes to medical records. The record must be secure. If you recall, many years ago, when we started implementing medical records, the key question was, you're moving the data from a register. How secure is it going to be once you automate it? And indeed, even recently, we have seen or read of computer breaches, such as what we had early this year, whereby a number of hospital machines were actually infected by virus. The question of security is key. So blockchain provides that level of security that assures confidence in the integrity of medical data. Patient safety is the second benefit. As I mentioned, on the block, you can add specific code called a smart contract that can either contain information such as alerting the viewer of the block when you are adding that this particular record, for example, this patient cannot take such a drug, or the drug you're about to add is contraindicated with the drug that is on the block. Now remember, the block itself can either contain the actual information or a hashed reference to information stored externally. So patient safety is another advantage. And then the third advantage that we're describing here is security, which is really linked to the first component. Then thirdly, within blockchain, we can now, for the first time, trace a particular transaction from end to end. And what we're really talking about here is traceability, logistics. So if you produce a product here, you can trace it until the point of delivery. That means that financial accountability can actually be enforced because you have full view of the record from first to last. Okay, so because blockchain also sits upon the idea of electronic currency, we hope in the future we can actually use or enable electronic payments for seeking healthcare services. And then lastly, there are some devices that do intelligent things. This is referred to as the Internet of Things, the idea of devices to communicate with each other. We are seeing a little bit of this with Fitbits, those rubber bands, those devices that we put on our wrists, which have the, of course, ability to speak to your phone or a provider. So now, Internet of Things benefits from blockchain because the key question around devices speaking to each other is this device allowed to make that modification or to submit data? So with blockchain, that device can actually write on the blockchain environment, and the blockchain can serve as a way to authenticate, indeed, this device is allowed to make such a modification or change. Now, I get back to the actual real world in terms of implementation of blockchain. I've already talked about Estonia. They have moved their medical record into the blockchain environment for the reasons we've talked about. And the implementation in Estonia involves implementation of medical records on the blockchain, of course, and also that allows for things like e-prescriptions and e-ambulance services. Also in Switzerland, there is also a move towards implementing blockchain based on smart contracts. So these examples are one of many examples that exist. Now, in my last slide, I'll simply talk about some of the software tools that are available that have that one can use to actually implement on a blockchain setup. So first is a tool of software technology called Medical Chain, which of course emphasizes its implementation on transparency. Now, what this basically means is that both the patient and the provider must be able to see the record and agree that the record is correct. Okay, that's one implementation. Now, MedRec is another implementation that is worth noting. It runs on the Ethereum open source infrastructure. And what MedRec actually does is it extends the idea of, if you recall on the first day, we talked about patient-held records, which are electronic records that the patient manages, him or herself. So what this particular implementation does is it empowers the patient to both provide access to a physician. So I say this record can be viewed by that physician. Otherwise, I can also say this record mustn't be viewed by that physician. So it gives power to the patient to be able to make those kinds of decisions based upon their ability to view the actual record that's on the blockchain. There's NanoVision, which combines the power of artificial intelligence and also molecular level data. This is another growing interesting implementation because it combines AI plus the idea of medical record systems. Now, GEM is also another interesting piece of software. Again, like MedRec, GEM was actually a subsequent implementation from MedRec. It extends MedRec and enforces the idea of giving the patient control over their own medical record system. Then lastly, but by all means not the least, is Simply Vital Health. So again, this platform is based on blockchain technology, but the main motivation for this particular implementation is patient rights and also visibility of the patient record. So the notion of blockchain, as I mentioned at the beginning, is a step towards making sure that you have a secure environment when it comes to medical records management. It also gives us power to overcome the issue of interoperability because the record or data in the blockchain is available to all the machines that are within that particular network. So that overcomes the issue of availability because all the nodes on the network can see the actual record. And then lastly, what I would like to emphasize is the collaboration between ICTs and health. As I mentioned at the beginning, this technology is heavily ICT dependent. And so this is why the ministries of ICT come in to support ministries of health in the implementation. The role of the Ministry of Health, of course, is to ensure that there is automation in terms of digitization of health, such as implementation of medical record systems. With that, I would like to suggest that we move forward to the next presentation on artificial intelligence, and then we'll take the questions at the end of the next session. Merci beaucoup and obrigado, and thank you very much.
Okay. Actually, the reason why we wanted to close this whole training by talking about the future is not only for you to be aware what will come, but also the importance of what we need to do today in order for us to leverage what will happen tomorrow. As you wanna see, I mean, AI is definitely one of the technologies that will have significant implication on how healthcare will be delivered, etc. But if countries wants to leverage the power of artificial intelligence, basically the work that needs to be done today is key. Otherwise, if you don't have the right foundation and the right data, you will not be able to leverage those technologies. So it's extremely important. If you don't want to be kind of sidelined in the future, you need to prepare from today and set the foundation. So let me maybe talk a bit about artificial intelligence. Artificial intelligence by no means is a new concept. It's not a new concept. I mean, people started to talk about the ability for machines to think as humans since long time ago. However, for the last few years, there has been some advances in technologies, in some advanced mathematical models, etc., that made this potential a reality. So I would like to maybe, I mean, this is definitely a very wide topic. It could not by any means be covered in half an hour, but I'll just give you a few sense of what does it mean and what are the potential and challenges, etc. I would like maybe to highlight few terms that are very common in the area of artificial intelligence. First of all is machine learning. You know, usually we are very much used to be able to program a computer, you know, to say, okay, this is what the machine will do, 1, 2, 3, 4, 5, 6. The machine learning is very different from that, is the fact that machine can start to understand and analyze and create their own models based on how they understand the linkages between some set of input and some set of output. So the whole idea is that machines can detect models and understand the relationship between a number of input data and a number of output data through the application of some mathematical models, etc. And the machines doesn't need to know any particular knowledge about the domain. It's just advanced statistical model and mathematical model where you can understand the relation between input and output. And I'm going to give you much more examples about what does this mean exactly. Deep learning is another term that is very much used, and it is let's say it's almost like an advanced version of the machine learning, using this new way of computing based on neural networks. So there are new paradigm in the computing that is using how our brains are thinking. It's called neural networks, and by applying those computing methodologies, you've been able to treat huge amount of data. So deep learning is exactly the same as machine learning, but that can run on much bigger sets of data. And again, the whole idea is to try to understand, if we have those input and if we have those output, what is the relation? Is there any relation? Because if we understand that there is a relationship, then we can predict. So the machine learning and deep learning are tools that are used not only for health, by the way, they are used for anything. They are very good in detecting and predicting and understanding relationship between data that usually and previously were not at all detected. And I'm going again to give you very concrete examples about how this applies to health. Another concept that it's important to kind of, because those terms you're gonna learn about, you're gonna hear about them a lot in the future. Natural language processing, NLP. Natural language processing is basically for a machine to understand how we speak. You know, the machines are very used to very structured data, but when we speak, it's a natural language. However, machines now are very, they have much more power to understand what we mean. So they just can be understanding the words, but the meaning behind the words. And this open up a whole set of new possibilities. And again, I'm going to give you some examples of how this applies for health. Augmented reality, where you can mix the reality, like videos or real images, etc., with digital information, and how you can link those two environments completely, where you can, for example, do an anatomy without having to go into or to do incisions and things like that. So it can take the reality but augment it with additional layer of digital information and link those two environments that are normally very separated, but they can link together. Chatbots, another term that you will hear probably a lot about it if you are not already doing it. It's a merge about two terms. Chat, we know all those chat tools, and bot is coming from robot. So it's a robot chat, meaning it's a tool or it's a technology that can create some sort of interaction and a machine that can respond to you in a way just by talking to the machine while you type or you talk. So you can type something in a chat, and then automatically the machine will respond to you because the machine will able to understand what you are saying. So you can say anything. What is the temperature today? So the machine will understand that you are inquiring about the temperature. And of course, we have all this functionality now in our phones in this, what you call the virtual assistant, where you speak with the phone, like Siri, for example, of iPhone, and the same for Android. And it has, again, a lot of very high potential application in the health domain. Supervised learning is another way the way we train the machine. There are different ways to train the machine. One of the way is called supervised learning, where we provide the training data sets. We say you can build up your model by giving you the training set. For example, we have a list of patients with those conditions, and then we can say those patients, this one had this condition, this one doesn't have this condition, etc., etc. And the machine can use this data set to train and create or identify the model that links between. Once the model is identified, then the machine in the next iteration will be able to detect and identify the conditions from any input data. So those are terms that apply for artificial intelligence in general. So now, how this applies for the area of health, and how this can be indeed a potential game changer for health. In that sense, ITU had put a primer, a paper. It's called AI for Health Primer, which is like 2-3 pages that will give you in like, if you read it in 10-15 minutes, you will have, you know, a primer, what is, and you will understand what are the main terms and what does it mean, etc. And this primer, we have put it on the USB that you will receive at the end of your workshop, which you can read later on to get a very basic sense about what is AI for health and what is the potential. So, so basically, what we were trying to explain that, as I mentioned, is AI is basically is this number of technologies that come together to create this ability for the machine to understand and think like humans. I probably mentioned many of those. What I want to highlight here basically is that in the way those machines can run, they can approach to a large extent, if not even surpassing the human accuracy. And in many cases, the accuracy that are coming from out of those AI algorithms are extremely accurate. Just to give you a quick example of how those AI can extremely be powerful is a recent technology that has been developed by a company. It's called AlphaZero. The company is DeepMind, but the technology itself, or the solution, is AlphaZero. And basically, this algorithm is able to train itself. So basically, and they apply it for the chess player, you know, how to play check. And the algorithm were able to, in 4 hours only, or less than 24 hours, learn itself how to play check and beat it the most advanced computer program that play check that has been based on millions or a huge amount of data over a number of years. In 4 hours only, the algorithm was able to train itself and beat this other program. So it just gives you the amount and the power that this technology can do. So deep learning is being used particularly, for example, in the way to the ability to analyze medical imaging, for example, whether this is any like brain imaging, retinal images, X-rays, etc., etc. And again, this can be used in a very powerful manner in order to, for example, detect the diseases even at early stages, which can be used for prevention, for example, and to avoid any future or potential complications. The natural language processing has been used, for example, to be able to understand the natural language and to mine the information that are in the EHR records that are written by doctors where they are writing their comments. But now the machine can go and try to understand what is the meaning of those comments and try to create some insights. Medical chatbots where you can chat with this chatbot. You can write your concern, write your question, and then the machine can respond to you. And whether it can be very useful to get information related to some health areas, but it also has been used, for example, during emergencies where you need very quick ways to get the information because you will have a lot of demand and you don't necessarily have enough operators. So you have those medical health chatbots that can respond to key issues during emergencies that are related to the emergency set or some health-related issues, first aid, etc. So as you can see, everything is depending on having data. So the business of the future and the real value of the future is having those data. Actually, the real value will come not from those who have the algorithm, not at all. Actually, it will come from those who have the data. Because if you have the data, you can, using people who are trained on data science, on artificial intelligence, they can get huge value out of the data. But if you don't have the data, then you will be not being able to leverage the power of AI, and basically the organizations who will have the data and have huge amount of data that are also of high quality and well integrated and interoperable, etc. Those who will be the one who will be able to leverage this, create algorithms and create insights and create value that will be leveraged for the improvement of the health population, and those countries and or those organizations who don't have will be sidelined, or at least they have to pay a lot of money to get this power. So really think about it with the with the advent of AI, the real value for the future is data. So all what we've been trying to do in the workshop is really try to put the right foundations, right, to build up this core assets that will be extremely useful for the future. So quick points about thinking about the potential, I mean, of AI for health. I mean, if you think about it, really the AI can be a game changer for universal health coverage. How this can be done? Actually, now you will be able to do diagnostics and early detection and improving treatment through those AI types of technologies at the point of care by using maybe a very simple mobile phone. Because, for example, AI is very powerful in image recognition and image understanding and image analysis, image recognition particularly. So basically you can, if you have the right applications with the right algorithm, you can detect a number of issues, and we're going to give a few examples, like for example related to skin cancer, for example. You can simply detect it with a mobile phone. About detecting early cases of retinopathy. Just with a simple mobile phone, you can take a picture with a mobile camera, and then the AI module can really provide you with analysis of the case and whether there is an early case of retinopathy where you can treat it in advance and can prevent indeed areas of complications. Currently in telemedicine, what happens that we capture the image and then send it to an expert, and then the experts come back with his own analysis and recommendations, etc. With the AI, basically this can be done on the spot without even needing to go back to and you can do at least a first triage or a first detection using those simple tools. You can also really move many of the power of detection to the hand of the people themselves. So you will have a lot of cases where you can detect a lot of conditions without necessarily having to go to the hospital. AI, of course, doesn't come with no challenges and new emerging issues that needs to be dealt with. Probably, as you can imagine, there are a lot of ethical issues that will be that are emerging with use of AI. Because now, for example, by analyzing and using AI algorithms over your health data, maybe you can detect that this patient is likely to develop some chronic condition in the future. So if health insurance are capable of getting access to this information, this might, create some sort of ethical issues, but also inequality issues and issues that are against the privacy and confidentiality of information. Also, many of those AI algorithms are very much as a black box. You don't know what is going inside. So, which means that for many cases, you are not very much sure of the quality of the AI and to what level you can really depend about the results of the algorithms, and you don't necessarily have the high confidence about the trustworthy of those medical algorithms, etc. So this creates a number of new emerging issues about how we can benchmark and how we can assess and validate those types of algorithms. Of course, all the regulatory and policy environment is not yet ready to adopt those types of technologies. Again, the issue of having the data is key, which goes back to many of the topics that we've been trying to cover in the workshop about, interoperability and integration, etc. So if your data is still in very much silos, etc., as I said, this will prevent you to leverage the potential of AI. As mentioned, this can be also creating some inequalities. For example, if your data set, your supervised data training is for a particular group of people, for example, for only white people who lives in North America, which means that those algorithms, for those who have those algorithms and those who have the data, will benefit more from the insights that are coming from those algorithms. But for those groups where there is no data about them enough to create the models that are relevant, will not be able to be in a position to leverage those new opportunities, which means that AI might create, indeed, in many cases or some cases, some inequalities. And then the biggest question actually is the ability to have high quality data that where you can use for learning of the machines and really can create those types of models. So I'm going to go through this relatively quickly, but just to give you a sense of how AI applies for a number of areas. Let's take primary care and service delivery in particular. I mean, AI now is already used, for example, in the diagnosis and early detection of chronic diseases, particularly in the area of cardiovascular, diabetes, etc. And the idea is that if we have the right information about and the right electronic health record about the patients, then you can detect early signs of diabetes complication, or you can define for example, people who are at risk of developing those chronic conditions, which means that you can, very much in advance, being able to alert and raise awareness of those patients for avoiding developing those chronic conditions in the future. Very interestingly, some of the things that are being very difficult to detect, things like, for example, autism, were very difficult to detect, particularly for early childhood. And there are now trials and algorithms who, by just analyzing through AI algorithms, the videos taken for children, they can try to detect signs of autism. You know, autism is sometimes very much detected very late in the process, which would be more difficult to address. But just by observing children, by taking a video of the children, even in a classroom, you can already detect by AI early signs or signs of autism that are not yet detected. And for example, children who have some difficulty of hearing impairments, etc. Cervical cancer is another very concrete case where very simple image recognition conditions can again detect some early signs of cancer through just simply by taking a picture and run an AI module on the picture from to detect early signs of pre-cancerous lesions from the cervical. You can now analyze the pictures of the blood to detect tuberculosis and malaria with some kind of equipment that can be used in remote areas where you can immediately detect by analyzing the images of the blood to early detect malaria and tuberculosis. Even snake bite detection, by just taking a picture of the snake, the AI will be able to recognize which type of snake is this one, and what are, of course, how you address how you can treat actually the snake bite. I mean, the examples goes on and on and on, but let me maybe go to another area of applications, for example, for emergency response and outbreaks. One of the possibilities, for example, that you see a lot of use of AI is, for example, using satellite imageries or even images taken by drones in case of disaster, where you can simply analyze the picture of wide areas of affected areas, and by applying AI algorithm, you can immediately detect the areas and level of damage, and you can immediately identify the priorities and level of efforts required, etc. It's already used significantly through detection of satellite images, particularly on how you mitigate risks in some areas. I think it was mentioned also in the previous presentation about using of social media to detect of outbreaks, because now the AI can understand natural language. You can mine social media, and you can detect alerts, or you can detect early signs of outbreaks, which can be rumors or can be a reality. But just by analyzing and mining the data from the social media, you can have very, very, very quick signs. Even before countries themselves are able to detect this, you can already detect those early signs just by analyzing how people are writing on the social media. It has been actually, there are some implementation in emergency where just by analyzing the tones of the people talking and understanding their concern, they can be dispatched to the right person. And in some cases, maybe the machine itself can respond automatically to your question before being dispatched, if the machine are able to respond, which will help significantly in how you provide, this quick emergency support for people who are affected during emergencies, etc. So again, we can continue to talk about that for a lot of cases. Let me just show you a couple of concrete examples. For example, this is a case of retinopathy. Of course, this is a big problem. I mean, as you know, millions of people have diabetes, and the diabetic retinopathy is probably one of the main cause of blindness worldwide. Of course, as we know, there is a shortage of specialists who can detect those types of conditions early on. So how we address this by AI, for example, so here is how it works. Simply you take a picture by your phone or even a low-cost camera, and you upload this picture to a cloud where the AI algorithm sits. The AI algorithm will be able to make an assessment because the algorithm has been trained from so many pictures who didn't have this condition. So the machine now can make the link between the input, which is the image, and the output, which is the diagnosis. So if you say, here is a million image about people, about the images of the retina from people who has or didn't have this condition, the machine can understand, if I see this picture again, I can already detect whether this person has or don't have or doesn't have this condition. So the algorithm that sits on this cloud can immediately provide a diagnosis, which goes back to the health worker, but at the same time, you can use the diagnosis to go back to an expert, to an ophthalmologist, to confirm or don't confirm the correctness of the diagnosis. So basically, you are using those cases to feed back into your algorithm to improve the accuracy of the algorithm. The more you can bring more data that are validated, the more the algorithm will be more accurate. So while you are already providing some value, you are using this data to improve. So over time, the algorithm can be very accurate. So this has been already piloted in India with level of accuracy that is much higher than specialists. So imagine that simply with a mobile phone, and this application, by the way, exists already. So we are already in the AI era. It's not something that will happen. I told you about this example from the SneakBite. It basically is about building a database of all the types of snakes that exist worldwide and being able to detect that immediately. I told you also about the skin cancer or any skin problem, where immediately by just taking the picture, it's very similar to the retinopathy but applied to the skin diseases. And for example, this application is able to diagnose 250 different types of skin diseases. It doesn't mean that we are there yet. I'll give you an example where we are not there yet. So for example, this application, it's an early innovation to detect the malnutrition in infants or in children, newly born. And as you know, this is a big problem. And again, sometimes it's a bit difficult to detect malnutrition because you need to do some measurement and you need to be a bit trained to do those types of measurements. So how the applications actually solve this issue? Actually, here is how it works. So basically, someone not trained at all, being able to take a picture of the kid or the child, and then the machine, the AI algorithm can able to, detect what we are looking. Those are the arms and the legs from the movement. The machine can understand where this is the shoulder, this is the arm, etc. And by doing that, they can immediately being able to understand the size and weight and all the characteristics of the body. And by comparing this to other data sets, they can provide some indication whether this is a case of malnutrition or not. However, this application didn't yet reach the level of accuracy and the operation that can make it really a game changer yet, because, for example, it's very difficult to get the child, sit and be, taking the picture. So it takes more time than the manual measurements to really take the right pictures that the algorithm can use. And then also the the algorithm is not yet being able to give you feedback if this picture is of enough quality to detect the malnutrition case, etc., etc. So there are still a lot of research to be done, a lot of improvements, but I just wanted to show you that if this application is simply by taking a picture from a child of a newly born, you can immediately detect the malnutrition. So anyway, I mean, this is just a 30 minutes teaser about the AI. It is by far the most potential trend that will have probably a huge implication on healthcare in the future. In that sense, if you want to learn more about the use of AI for health, at ITU we have created a new, what we call a focus group for AI for health. The AI has a website. Okay, so I didn't put the link, but it's very easy. You just type ITU focus group AI for health and you will get it. The AI is open for anyone who wants to participate, whether to share new algorithms, etc., or just for learning. And we have physical meetings, but also we have a lot of content and resources that are available online. And one of the main things about this focus group that it will try to provide frameworks to validate the algorithms, to create some benchmarking that you can say, this type of algorithm we have benchmarked and it performs at this level of accuracy. So authorities and Ministry of Health will have the confidence of being able to use such algorithms using those types of benchmarking frameworks. So anyway, I'll stop here. Again, the core message is to say that the future will be really dependent on your ability to have data that are integrated, not siloed, and accumulated over a long period of time, where you will be able to detect. I mean, we've seen in the morning data analytics. AI will take data analytics to much further possibilities, and we can really improve. But if we don't act today to prepare those foundations, then we will not be able to leverage, at least fully, because some of the algorithms are not data intensive. Some of the algorithms, they don't need to have huge data sets, etc., but some algorithms are. So anyway, I hope that this gives us appetite to learn more about the AI, and also to be able to start to build capacities about data science. Data science is definitely the science of the future, and we've been talking since the beginning. What are the different skills? Here is another set of skills that will be required to leverage those types of trends in the future around data science. So, which means that universities, academia, ministries of health need to start to build their own capacity in understanding how they leverage this new science. Thank you very much for your attention.